So here we are at the beginning of your preparations for finals. You're dreaming about your graduation day, how you're going to feel as your parents, your family, your friends congratulate you on becoming a doctor. It seems a very daunting task. The huge tomes of medicine, surgery, obstetrics, pediatrics, and all the other specialties that you have to cover. It's extremely hard. We all appreciate that. And so this resource is going to help you really think about how to prepare and how to successfully pass the exams. Students prepare in many different ways for finals, and if we look at these three graphs, it does show the spread of preparation. It doesn't really matter about the time axis along the bottom, but let's think about the red line. Students working extremely hard right from the beginning of their preparation, reaching a peak, and then trying to maintain that over several weeks, even months. It sounds like the perfect way to prepare for finals. But what we find is if people really work very hard at the beginning of the final year, that they can't maintain it, particularly the revision and the amount of hours required in the clinical assessments to maintain that amount of peak performance for so long. And what you find is this curve starts to dip and they actually fall away towards finals. Of course, the ideal will be the middle line, slow but sure preparation all the way to the top. And that's what I would really recommend. When you start at the beginning of the year, you really put in a nice, consistent effort all the way through. And then, of course, we have the extremely chilled students at the bottom who leave it right to the last minute. And we know the majority of you like the pressure of the exam before starting your preparation. That's fine for the exam, but I think you're going to find it very difficult to reproduce those skills as an FY1 if you haven't really got out of bed during the early part of the year. So, the top tips. The number one tip, and I think this is the most important thing I'm going to say today, is that I think you need to think about being an FY1 doctor and learning to be the best FY1 you can be rather than simply learning to pass the exam. This kind of headline from the press, the killing season on NHS wards, usually appears around June or July time and really furthers the idea that there are major problems of new doctors starting work. And actually, that isn't true. But there is an anxiety both from your side about starting your new job and, of course, your senior colleagues working with the new doctors. This is a slide of many years clinical experience, and although it's never really been produced in terms of undergraduate experience, I think it probably is reproducible. If you look at the axes, it shows that the longer you're in practice, the more cases you see, the more your clinical experience grows and the more your diagnostic accuracy improves. And I think that is the key to being a success at finals and, much more importantly, being a success during your foundation training. And what we really need to see is students out on the wards taking part in the everyday activities that the clinical environment allows, and with guidance and supervision performing the jobs of an FY1. And these will translate into being not only a good FY1 but being a success in the exam. And I couldn't possibly do a presentation without mentioning McNamara's fallacy. This is Robert McNamara, who was the Secretary of State for Defense during the Vietnam War in America. He was an extremely clever gentleman. He'd been the CEO of Ford Motor Company. But he came up with a rather dull plan for working out whether the Americans were winning the Vietnam War. And this was by a body count and counting graves from the air and aerial photos. And this became known as McNamara's fallacy, and this is a reinvention of it. And what it really says is that it's all very well measuring things you can measure, which the OSCEs do very well, but what about the things that we can't measure? What about the things that rarely appear at finals that you will be judged at on your first day as an FY1? Many of the things on this list are not going to appear in your exams because they are actually quite difficult to assess, but they are essential for you to be able to do, to take part in, so you understand not only how to do the job of work, but what the job of work entails. Top tip 2, concentrate on the things that you can influence and forget about the things outside your control. Students like to worry. They like to worry about all of the things that are coming up. You know yourself, you're worried about how we set the pass mark. How many marks do I need to get to pass? And then all those what ifs. The what if I arrive on the wrong day, the wrong circuit? What if I miss a station? What if my examiner goes AWOL during the middle of the exam? What happens if I need a toilet break? All of these things play on your mind. You must put them down and let us worry about those things. They're not important, they're out of your control. You need to concentrate on being as good as you possibly can on the day. So, preparation, preparation, preparation. Really important you prepare to be the best FY1 you can and in turn pass your finals at your school. Statistically, you're a very safe bet. If you put in the hard work, if you've been around, if you know that you've actually seen a lot of patients, done a lot of procedures, you will pass finals. It's not designed to be an excellence exam. It's designed to be a hurdle that you go over, that you pass into graduation. And at most medical schools, the finals pass rate is well over 95%. So you have to ask why you as students get so anxious. We all know the answer to that. This is perhaps the most important exam of your life. But the odds are extremely stacked in your favour, and you will do well if you put in the time. And just remember, if you are going to go on a course, think about the claims that 95% plus of those students on the course will pass. Of course that's true, because that statistically is the number that pass finals. But also, if you are going to go on expensive finals, make sure it's a finals course that's aimed at your finals and not necessarily a generic course. So, when should you start? Well, that's totally an individual question. You know yourself how you need to work. But I would recommend that if you've been working hard, you will make an extremely good FY1. To pass finals and to concentrate on finals probably takes about 8 to 10 weeks. And of course, for everything else, there's Pastest. Really important, one of the things that we see a lot of in final year is students isolating themselves during the preparation towards finals. They either go home and live at home, and they isolate themselves away from their peers. This is a big mistake. You must be working with friends, with peers, and being judged against how they're performing. That gives you an indication of not only where you're at, but where the group is at. A giant step forward is therefore forming a tutorial group in specialist subjects, medicine, in surgery, and all the other subjects that you may be sitting at your medical school. Really important to work with friends, not only for that judgment, but also for pastoral care. Let them help you along, let them cajole you and support you. But we all know friends will never tell you when you're doing things poorly. And for that, you probably need to seek out perhaps the most scary of all the seniors within the various clinical areas that you'll be working. They will give you often very frank and often very robust feedback on how you're doing. But it's important that you realise there are areas of weakness and work on those as well as your areas of strength. Top tip 4, know your enemy. It's really important you think about the exam at your medical school and not just the generic OSCE. Greta Weitz, the great Greta Weitz, who sadly died last year, used to say, don't bring a 26-mile race to a marathon. You all know that a marathon has that 365 yards, and that 365 yards, let me tell you, is the hardest bit of the race. You really need to think about what is it that they're assessing at your school and prepare for that. Nothing should come as a shock. The first thing that students often say in finals is, I was terrified. I got into the exam and I was absolutely terrified. That's because students haven't had senior people watch them and give them feedback. And it's really important that you seek their observation and feedback, because they will be the ones that give you frank and honest feedback. But not only that, they will give you the fear that you need to reproduce, that when you're going into the exam, you think it's not a problem. You should all be probably very familiar with the environment and venues. However, at finals, because of the number of students and the slightly different format, often venues may vary between local hospitals and quite distant hospitals. So you need to know where you'll be examined and go and visit the venue. Find out exactly what the venue is and how you get there. The examiners. You'll have been examined by most of these people throughout your medical career, but sometimes it's a shock if you get a very senior person during the exam. So it's important that you are familiar with the examiners that are going to be within your OSCE. You'll all know the format and content, but the format and content of exams are changing, and as we move through, you need to think about, has the exam changed recently? You should all be familiar with the mannequins, the equipment that are used in the skills departments, and so there should be no excuse on the day that you weren't prepared for a new mannequin for blood gases that had recently been introduced. You should also be aware that in finals in particular, we use real patients with real clinical signs, and of course we use simulated patients, particularly for the clinical communication stations. And that brings us on to the next point. Top tip number 5, your success in the OSCE is built around the ability to combine the content and the process. So let me explain. The content is what you say and do. It's built around actually what you're being judged upon, and for most students this is what they concentrate on. The knowledge within the station, the skills, these make up the majority of items on a detailed itemized list. But the content is what a novice concentrates on, and is really something that students within the earlier clinical years devise how to pass the OSCE. And it's not something which is dwelt upon as much within the finals performance. Process is how you say and do things, and this is much more important, or has much more emphasis during the finals exam as it did in earlier years. These are often now themed within checklists, so instead of being detailed as the knowledge and skills are, they're bunched together in domains: hygiene, safety, communication, how fluent and professional, your diagnostic reasoning. And over the last few years, this has actually led to the domain-based checklists, which we're beginning to see more and more in finals. So you're all used to a checklist like this. This checklist is taken from a chest pain station, and as you will all know, you will concentrate on these individual items, trying to tick them off in your head. And as you do so, it's often very painful to watch, but also very obvious that you haven't taken this kind of history from a real patient. And therefore, many schools have moved towards a domain-based checklist, where, as we say, we have bunched together themes and given you marks and grades around themes. And as you can see on this domain-based checklist, we give grades on not only themes within a station, so the content, but also generic themes such as professionalism, diagnostic reasoning, that can then be generalised right across the whole OSCE, and therefore you'll not only get feedback across the checklist or down through the checklist, but across the whole exam in how you did in terms of diagnostic reasoning, professionalism, your content, etc. Top tip number 6. You can't make a diagnosis without taking a comprehensive history. You can't take a comprehensive history without knowing stuff. That's really important to remember. Through all of this, despite OSCEs really assessing the skills that have picked up over the last few years, you have to have a very sound and very solid knowledge base. Without that, you will have a very poor range of differentials, and because of that, you won't be able to take a comprehensive history. Clinical communication skills stations include history taking, counselling, and discussion of management or data investigation results to patients or simulated patients. As I've just discussed, as with all clinical communication, knowledge is power. Now, if we look at your knowledge base and that's poor, what tends to happen is your questioning style, your ability to diagnose what is wrong with the patient becomes extremely fragile. And as it does so, you then become extremely fragile and you're unable to get across what you're trying to do. So it's really important that you have a strong knowledge base. That will make how you ask the questions a lot stronger and make your performance a lot stronger. The thing that I always am amazed at in finals is students run out of things to say. In a 10-minute station, you should be at least 7 or 8 minutes before you're thinking of concluding. So if you get to 5 minutes, you really haven't asked all the questions necessary. It's always worth re-investigating what you've asked, reflecting back on the simulated patient or on the patient what you've already gone through. This will remind you where you're at and where you need to be. So remember to ask all of the questions through each of the systems that are relevant. Top tip number 7, break the habit of a lifetime and take responsibility for your words and actions. It's very easy as a final year medical student to sit in and watch some very challenging and difficult events unfold in front of you and not realise that in 6 months or a year's time, that'll be you actually having to explain to a patient that they've got a terminal diagnosis or a very difficult or challenging set of relatives come to see you, and you actually are the person that's going to be explaining to them what happens. And OSCEs, unfortunately, don't really encourage you to take responsibility for this kind of thing. So it's important that you do observe and think about how you will do this in real life, because this is one of the biggest shocks that graduating students find, is that they are the person that's put in at the deep end and having to give this important information to patients, particularly in the hospital environment. You need to practice presentation and Viva skills. It's all very well taking a history, it's all very well being able to do the examination, but you have to be able to assimilate the information that you've gathered and then put that into some kind of diagnostic formula. My tip for you in this is that if you come to the end of the history or examination and you know exactly what you found, you should present it as a fait accompli. And this would mean you would say, this is what it is and this is why. For example, if you were presenting a patient with a pleural effusion, you say, this patient has a pleural effusion, and then you would present the signs of a pleural effusion. However, it's more difficult when you're unsure as to the exact diagnosis, particularly in an examination. And this is a skill that you really need to master. If you don't know the diagnosis, presenting the facts in a coherent and systematic way so it allows the examiner to understand that you have actually found the diagnosis, you're just struggling to put a single diagnosis together. And as long as you make some sensible suggestions, this often will give you all the marks. Something that students find very difficult is being challenged and stopped during mid-flow of a performance of doing a full examination. So you must ask people to stop you at the various stages of an examination, of a history, and be prepared to justify what you've just done and think about what you might be asked to do. For instance, after examining the hands of a patient where there's an obvious diagnosis, you may be asked to come up with some differentials. This brings us on to top tip number 8, which is learn to be a diagnostician. The thing that separates medical professionals from perhaps every other allied health professional is that we're thinking about how you make a diagnosis and what to do once you've made that diagnosis. Okay, so now it's all about trying to make a diagnosis and become diagnostic. You can't just take the history or do the examination. You actually have to show some product at the end of it. And that will set you apart, not only in finals, but also when you become a FY1. Students get very fixated. You all know you want the diagnosis. You want to know the single valvular lesion. You want to know what was wrong with the patient. But actually, medicine is a lot more grey than you think. Even those clever GPs and consultants often have a range of sensible and close differentials and not only manage but treat the patient for those. So it's really important that you have a wide range of knowledge to feed into the differential diagnosis. And just remember, if you're finding it really easy, everyone else will find it really easy, and it will be expected that you score very highly on an easy case. So paradoxically, it's probably more beneficial if you're doing well on a relatively harder case. We come to stations which I call the thinking student station, and as I go around the country as an external examiner, indeed at Bart in London, we're introducing more and more of these holistic type stations. Tends to throw students quite a lot because the instructions tend to be a lot more relaxed than the definitive do a cardiovascular, do a formal respiratory assessment. And as you look along that list, as you look down the list, you can see that they're much more holistic and are asking you to assess an awful lot more than just a single system necessarily. If we take the bottom group, the patient with cancer, if I ask you to assess a patient with lung cancer, for instance, we'd expect you to examine the abdomen for hepatomegaly, we'd expect you to examine the skeletal system for bony tenderness, and perhaps for paraneoplastic phenomenon like a cerebellar examination. So these are the kind of stations that you must be prepared for. And as it said at the top, it may come as a real shock to you, but actually they're totally predictable. Something that you won't worry about if you've been in the clinical environment, but something which is very true, and that is mannequins aren't real. It may come as a shock to some of you. Mannequins don't cry, they don't question, they don't suffer. It comes as a real shock to final year students when they go out on the wards for the first time, put in a cannula, and the patient cries because it hurts. You have to realise that if you've practiced in the real life environment, that you're putting in cannulas, putting in needles into mannequins is second nature to you. Whereas actually when you go out on the wards and you've only practiced in the simulation of the skills centre, what you'll find is that you will find it very hard because people are not mannequins. They ask questions, they do suffer, they will cry, they will shout at you as well. So my top tip, number 9, make sure you go out in the clinical environment and you practice your procedures with real patients. So practice, practice, practice. Taking history with friends and practicing procedures on mannequins is all well and good, and it's very important that you do that to not only gain confidence but to practice OSCE technique. But practicing all of these procedural things with real patients in the real clinical area is not only much harder. Think of a clinical area, you haven't got everything to hand, it's a lot more noisy, it's often a lot more difficult to do and perform the procedure. But this will stand you in much better stead, not only for your FY1 year, but also for passing the exams. Top tip number 10, whatever happens, however you think you're doing, just carry on. The old adage, keep calm and carry on. You will have some less good stations. It's impossible not to, particularly in a very long OSCE of 20 to 25 stations. You will have stations that aren't so good. But 1 or 2 bad stations, as judged by yourself, is not going to make you fail. Students often think and remember the really poor stations that they did in an exam. A paper many years ago showed that students were very poor at judging how well they did. So just carry on. It's very hard sometimes to put things out of your mind, but in a long OSCE circuit, it's very important that you're just able to put things down that don't go so well and move on. Of course, all of this is minimised by good preparation, both in the clinical areas and in the simulation of the skills centre. And there are things which are totally beyond your control, which, as we've already said, you need not worry about. Things like equipment malfunction. If the mannequin doesn't work, doesn't do what it's meant to do, we can stop, bring you out of the circuit and either put you back in at a later time or indeed put you into a circuit later on. Even if it's the last circuit of the exams, we can usually find a friendly examiner to sit and watch and observe you do the station again at the end. You can't control the performance of the student ahead of you. You always hope that you've got a student who's setting a nice performance for you to follow. But if they don't do well, it's something that you can't control, but what you mustn't allow is that to affect your performance. It's very important that when the time bell goes, that they're moved on and then you moved into the station. And finally, if you put in all the hard work that you should have done and you've done the very best you can do, you will at the end of it be able to call yourself a qualified doctor. And ladies and gentlemen, let me tell you, it doesn't get any better than that. So from us at Pastest, we wish you the very best of luck and really hope that you'll use these resources wisely to help you not only pass the OSCE, but become the very best FY1 doctor you can be. Good luck.